evening. I'm Amy Robinson, News Director of WCMU Public Radio. It's good to have you here tonight for our Moving Forward Midland conversation. This is an evening to really talk about what Midland's been through under the twin crises of the COVID-19 pandemic and historic flooding. And so we want to look at, yes, some of the challenges that you and organizations in your community have faced, but also how the community is moving forward and services and opportunities that might be available for people to as you go through the recovery. We've really tapped into the key sectors of the community, I believe. And so that includes arts and culture. It includes the business community, the United Way, so looking at some of the assistance programs that are available out there, as well as the governmental piece of Midland, looking at that as well. And then, of course, healthcare, which is so important through both of these issues. So we encourage your questions. It is your questions that are really going to fuel this conversation. You can join in the conversation by going through Zoom to the question and answer box and typing in your question that way. And then we will try to channel them to the appropriate panelist when we receive them. So please join in. We're going to have our panelists introduce themselves and tell us a little bit about their piece of the community that they deal with in Midland and how it's doing when it comes to COVID-19 and when it comes to the flooding and the recovery around those two. So we're going to start with Terry Trotter from the Midland Center for the Arts. And, you know, we know from talking with you, Terry, that one of the issues that your center is really kind of grappling with is the fact that people can't necessarily gather together right now because of COVID-19.
When we do have to maintain this social distance. And additionally, how do we do that when, you know, we're anticipating we could, you know, be 50 to 70% less on our revenue that generally comes in to help us maintain that over the next year. So that's been our challenges there. And then, of course, in May, on May 18th, we did have flooding impact all of our buildings. Probably some people are aware that Midland Center for the Arts also oversees the Midland County Historical Society. We have 5 buildings there down on West Main Street. All of those buildings, as well as the center, were impacted in terms of some of our systems that come up, as well as just lots of standing water in the buildings. And so we're estimating that damage at around $9 million. So we're now in this interesting place of figuring out how to get those buildings back online, but also how to improve them. And how do you balance this idea between when can we bring people back in, or how long should we wait to bring people back in? You know, if we can make some upgrades and things that will be good for the community. And that is certainly our hope. And then, of course, we were also very concerned by some of the social justice issues that have arisen in our society. And that's been a challenge for us as well. You know, as a cultural center, we are a place to tell stories. We are a place that welcomes everybody. We are a place where you can have tough conversations in an interesting way. And so not being able to engage in that has been particularly difficult during this time, not being able to engage in that in person. And so we have really taken that online as well. So that's our 2020 story to date, Amy.
Just this much to work on, right?
That's right.
Fortunately, you have this wonderful community of creative people. So we're going to be excited to hear about some of the things you have, as we say, moving forward.
Absolutely.
I want to welcome Brad Kaye, the Midland City Manager. We go from the kind of arts and culture piece to the governmental piece. And Brad, tell us a little bit about what you've been doing and observing.
Well, thank you, Amy. And as Terry said, I appreciate the opportunity to be here tonight. Terry hit quite frankly on the three-headed monster that we've been dealing with, or at least the overriding issues. We've certainly dealt with the COVID-19, the virus that's been in our community and the challenges that presents, the flood that followed after that, and trying to blend how do you do a flood response to in a COVID-19 environment itself and not violate truly the orders and the safety precautions that are necessary. And then we've had social unrest in terms of social justice concerns as well in the community, all of which have been in that same capsule as well. From the city's perspective, we're a little bit different. Portions of our operations are meant to gather people. So things like our parks and recreation facilities, our civic arena, our golf course, all of those are intended to attract people, get them out, have them enjoy being together, none of which really in the initial days of this was what we were permitted to do. We've had to close a number of facilities. Our pool, for instance, much to the chagrin of many of our community members, we had to make a decision earlier this summer to close that down for the entire season, simply because we could not, number one, socially distance in that environment, but number two, even when we were allowed a little bit more intensity of people back into it, we couldn't gear back up in a short range and put the staffing back in place that was necessary, as well as all the protective measures. The flood, of course, hit in the midst of all of that, and we've had tremendous devastation across not only the city of Midland, but the county and upwards into other counties up in the Gladwin area as well. And all of that was a regional response that really became necessary at that point in time. And many of the people that are here on this talk tonight were part of that response, making sure that the immediate and long-term needs of our community was responded to. We had houses that had been substantially damaged, condemned, destroyed. We have people that have been misplaced and are in need of housing, and all of those were the short-term needs. The longer-term needs now are what we're transitioning into, and that's finding an ability or a way forward for people who may not be able to rebuild the homes that they lived in and have called their homes for perhaps a number of years or even decades in some cases. And those are the heartbreaking stories that we're dealing with right now. And the cruel reality is that the regulatory environment of living in floodplains and living near a river sometimes makes rebuilding the community very difficult. And that's what we face today. And then just in general, we're just in the process really of rolling back open. Our city hall was closed for a number of months, again, for the same reasons under the COVID-19 and the governor's executive order restrictions. We've been reintroducing those services slowly as we move along, and that brings challenges. We have to make sure our frontline responders, our police, our fire, our dial-a-ride drivers are all put in a safe environment. We have to make sure that the people who had to collect all the refuse from the floods were not exposed. The assessors who had to go out door to door to do damage assessments also had to be protected as we move forward. So it's certainly been a challenge. We learn on the fly and we continue to do so.
Brad, welcome this evening. We're delighted to have you here to help answer some of the governmental and questions related to how people are going to just get by at a very practical level in the Midland community. Someone else helping to that end is Holly Miller with United Way Midland County. Holly, tell us a little bit about yourself and what your agency is looking at this point in time.
Thanks again, Amy, and it's wonderful to see everybody. United Way's mission is really to bring the community together to improve lives. We certainly have had an opportunity in 2020 to do that and to really lean into that mission. 2020 has been one for the history books. I think we can all agree. And it will be, there are so many lessons learned from this, and I think some things that we've learned to do differently. The collaboration and the way that we have really come and unified in response to both COVID and the historic flood and the unrest has been a game changer for many of us. United Way, during the COVID period, while others were kind of leaning back, we were really leaning in. Recognizing that sustaining our nonprofits was just really important, and to make sure that they came out of this okay. We also looked at those essential workers and childcare issues, and we recognized that that was a really big need, especially for those frontline workers, to ensure they had a safe place for their children to be amongst the COVID pandemic. So that was some of the areas, especially at increased basic need too. We saw a lot of folks that are needing to ask for help for the first time. We had predicted and had seen the unemployment rate drastically change during the first 3 months of COVID, which leads to a lot of people needing to ask for help for the first time. And how do you make that okay? And how do you make sure you're there as a community to respond to those needs? Then came the second punch, the 1-2 punch of the flood during the pandemic. And again, I think that as a community, we really learned that we are stronger together, and that the only way to come through any kind of crisis is through unity and through working together. I'll never forget the day, the hour that the dams failed, right? Many of us were on a call. And it puts a lot of things in perspective for you very quickly, because you recognize that there's going to be huge needs, and you can see it coming, but you can't see it face-to-face yet. One of the things I will forever celebrate in this crisis, especially the flood, is that we didn't lose a single life. And that is really a testament to the city, to the county, to our first responders, to our state police, to our volunteer firefighters who just rose to the challenge. I just think that's amazing to evacuate 10,000 people and have no loss of life. That is huge, and a testament. So some of the things that we're seeing with the flood is certainly that just huge need of individuals. We leaned in, and first and foremost, we have a national event like this. You have a lot of folks from around the state and around the country that want to help, which is amazing. But we kind of leaned in and said, okay, how do we manage the $1 million+ of in-kind donations flooding into our community from across the country? And how do you get that deployed back out to the folks who need it most? And so we partnered with many in our community to set up a series of distribution centers to put those donated items to good use. That also helped us leverage over $1.5 million that we didn't have to spend for a flood recovery, which I'm sure, as we'll talk later, it's all about leverage. There's just significant damage and there's not enough dollars to put it all back together. So I say it's like the barn raising of the century.
Thank you for joining us tonight. We're looking forward to hearing more about some of the programs that might be available for people as they look to, continue putting their lives back together in Midland. Thank you, Holly. Healthcare is always a huge component in both of these crises that Midland has been facing. I have to believe that Mid-Michigan Health just came out of the gate right away when COVID hit, because you had no other choice, and you have a lot of good people who step up and help with that. Diane Postler-Slattery, thank you for joining us, and tell us a little bit more about what you're experiencing in your health system.
Sure. So as you said, from the minute that we were aware of the COVID-19 virus, just like every other healthcare organization in the United States, we ramped up immediately to try to handle the projected huge surge that was going to happen. And, certainly the preparation for that is something that we have in our history. Emergency preparedness is one of the core things that we actually do drills on. So a blessing is that we got to use our emergency preparedness plan twice for COVID-19 and for the flood. And we have found that it worked quite effectively in a lot of different ways. But I think what really hit home is that we had to go through all that preparation and be ready. And, elective surgeries got canceled, lab testing got canceled, everything got shut down in March. And that certainly, as you've heard from of the other panelists, has certainly affected this community in a big way, and also economically for Mid-Michigan Health. And the blessing, if there, we talk about the blessings that have happened, the blessing is we really have been blessed with low volume of COVID cases. Now, one is too many, but we really have seen not the surge that was expected. And, every day we do a scorecard here at Mid-Michigan Health. So the scorecard is our entire system. So that goes all the way from Alpena to Elma. But if you think of it, so far in our entire system, we've had 532 positive cases. But out of that, 94 have been hospitalized. So in our entire system, there's only been 94 patients that have been hospitalized. And in Midland, there have only been 44. So again, if you put that in perspective, that's quite remarkable. And I would say, whether we all agree with the executive orders or not, there were many things that really did help. The masking, the social distancing, the staying at home. So those things, we believe from a healthcare perspective, helped us, particularly in this community. And we were able to learn from Detroit and Lansing, from the things that were happening there, so we could even be more prepared. We have a relationship with Michigan Medicine, which certainly helped us through this crisis. And we were one of the early adapters with Mayo Clinic to get involved in a plasma trial. So what we were able to do is patients who had tested COVID positive, if they were willing to donate their plasma, we were using that as research to see if that would be successful for patients who were now very sick with COVID. And there has been some success with that process. So some of the relationships that we developed really have helped us with our process. So where are we today? So if I just quickly talk about the flood, and I don't want to in any way, shape, or form have people believe that the COVID crisis is over. I think all of us believed it would be over by July, and now there's speculation. Honestly, until a vaccination occurs that's effective, we are all going to have to deal with COVID on an ongoing basis. So it's no longer a crisis. It's just the way that we need to do business going forward. The flood impacted our Midland facilities significantly. The cost overall is going to be about $13 million of damage. We lost our urgent care. We lost one of our buildings on Saginaw, and then we had about 9 feet of water in our lower level of our hospital, which housed our IT staff and our supplies. So we had to course correct very quickly. We had enough warning from Brad and his team and others in the county to help us prepare for the flood, and we were able to move our supplies, and we're currently using the Sears building in the mall to help with our supplies. So where are we going to go from here with COVID? We're just going to continue to use our resources, be state of the art, follow the executive orders, and continue to make sure that we're giving the message out that it is safe to come for care. We don't want people to delay their care. There is a concern if you delay your care, whether that's stroke or heart attacks or cancer diagnoses, people have died because of that, and we don't want that number to overshadow the COVID number. So we're trying to let people know it is safe to come to the healthcare facilities, and we are doing everything we can to protect people. So interesting times, as everybody has said. And my last quick comment is I can't believe the outpouring of support from this community. In fact, all the communities we serve. And it's just one of these reasons why I absolutely love living in this community. You know, I get choked up about it. The signs on our campuses, the signs on streetways saying, thank you, healthcare workers, and just the donations that have happened. And this is what community is all about, coming together when we're in crisis.
Absolutely. Thank you, Diane. Thanks for being here this evening. And finally, our final panelist that we're excited to talk to works with businesses every day, and is such a crucial part as Michigan, as the country, and certainly as Midland works to reopen and get its feet back under it, is Tony Stamas with the Midland Business Alliance. And Tony, how are things looking for businesses right now?
Well, Amy, thanks for having us. I really appreciate this opportunity to talk about what's happening in Midland. And it's great to be with such a wonderful group of our community leaders here tonight. You know, obviously, and I'm President and CEO of the Midland Business Alliance. And so we're focused on helping businesses. And as everybody's talked about, between COVID and the flooding, it's had a profound impact on our community and certainly the businesses. Our team's been busier than ever trying to work to help people navigate through these really unprecedented times in a lot of ways. And, you know, we've tried to take a number of different ways to go at that. You know, we put together toolkits for, you know, those impacted by COVID-19 for businesses. Okay, here's some resources, here's information, here's best practices. We put together a toolkit for the flood with the same thing. Here's the resources, here's what's available, you know, from the state, from the federal level, and just trying to help help businesses and those impacted kind of know where to go and where to get assistance. And so we still have those on our website, mbami.org. And so, you know, anybody that's listening and interested, I would encourage them to go there. We're trying to update that regularly as it seems to be ever changing. Communications has really been a focus organizationally. You know, Diane talked about the executive orders. I think we have 169 currently. And so for businesses, those are very impactful. And, you know, when we talk to the business community, they want to do things right. They want to keep people safe, but they need to understand those. They need to understand what the best practices are. And so we've been regularly communicating as they come out. Okay, here's what we know about them. Here's what you need to do to make sure that you're following those. And so that's been kind of an ongoing effort. And then, you know, like so much of the world, we've went to virtual communication. So we've interviewed the Small Business Administration. Michigan's Department of Labor and Economic Opportunity. Warner Norcross and Judd talked about, some legal obligations. We had an educational session planned this year. We do one every year, and sadly, it was a little prophetic. It was on resiliency. And so we had a speaker, Ann Grady, talked on resilience, and she's actually going to come back in the fall and do a longer session, but hard to see how that could have been more appropriate. We've been fortunate from both the state and from local foundations to get support, and so we've given grant money out to both help those impacted by COVID and those impacted by the flood. We did I think a fun event this summer. We did the Great Gift Card Giveaway. So over 40 days, we gave a $100 gift card away for a different business in our community. And, was trying to get, people to go there and spend the money, but also just help to promote those businesses and support them. And so we received tremendous response. We'd say, okay, you're eligible if you like or share, and we get 10,000 responses on a given day. And so that was exciting to see that. And, still in the midst of this, trying to figure, okay, how do we continue to operate as a community? It's a great community. Challenging times, but there's a lot of wonderful things that are still happening. We run the Midland area farmers market, and so we said in May we moved 3 times. We were obviously at the traditional farmers market where it was flooded. We went to Dow Diamond over on the east parking lot, and we had to move for COVID testing, and now we're back there. But trying to do that farmers market, I was down there Saturday. Great response. We're keeping people spaced out and safe, but just it is a great community. We know it's a challenging time, but we're also know that we're going to work together. We're going to keep Midland moving forward.
Great. So to our audience, we have 6 of us here, and 5 of them are here with special knowledge bases to give you information on your community. This is your program. We want to hear your questions. And the way you do that is on the Zoom app. You're going to go to the Q&A button. Just type in your question, give us your first name so we know who's asking, and type in your question, and we will do our best to get to that. So we do encourage participation. In the meantime, I have plenty of questions. So you know what, I want to circle back for a minute to Terry Trotter with the Midland Center for the Arts. Terry, kind of a simple question, and yet I'm sure it's not simple to answer. When will your performances resume?
So performances have actually already resumed, but we are not in the building. So we have done a couple of outdoor events, and we'll continue to do those. Last Thursday night, we kicked off our curbside comedy events. And so every other week through the summer, we will have a comedy night. It is outside in the front of the center. It's all socially distanced, and outside we do have a capacity limited to 100 per the state regulations in that. But so that is going on. We had a Traverse City musician named Joshua Davis who performed for us outside. So we do have things going on. Every Thursday night we have our happy hour out on the patio, and we have local musicians who perform, and that is actually a free event in terms of the music, and then you can come in and just come out and enjoy drinks and snacks and things of that nature. In terms of when will performances begin back in the theater, that is the magic question, right? That the entire arts industry is asking. Broadway right now in New York is on hold until at least January. They have said they're don't expect to be back until January. Most touring Broadway, so the big shows that come across the country and that we get the opportunity to see in Midland, again, most of them now are canceled through the end of the year. We are hoping, we have on sale right now a Broadway subscription that begins in March. So March of 2021 and runs through the summer. We're very excited about that and hoping that that will come to pass. But, as Diane said, this is what we're living with at this point. And so, as an industry, we also are adapting and waiting to see, what will happen and, at what point we will feel ready to go back into the theater. Even, and it's interesting because it's multi-layered, right? You have the audience issues, but the performers issues as well. At what point do we have a group of 20 people up on stage singing to each other? So a lot of different issues happening there.
In the meantime, how is the staffing at your center? Have you had any layoffs with the difficult finances you've been facing?
Yeah, so we have had to furlough our part-time staff at this point. We did have a few layoffs, and we have some of our full-time staff on more of a part-time furlough basis right now. We have been relatively fortunate in our region, as everybody spoke to what an amazing community this is. The other thing is, because the center does so many different things, you know, we have colleagues around the country who have literally at this point laid off 80% of their staff. You know, they have minimal staffing because they have just shut the doors. They aren't doing anything online. So the big performing arts centers that bring people through. We of course have a lot of varied programming at the center and work with a lot of volunteers and things like that. So we have, you know, we have been impacted, and it's really, you know, it's a difficult thing for all of us to go through. But we've been in a pretty good position relative to what's going on around the country. You know, that's a big question, is how are these arts organizations going to get back up and running? You think about the idea of losing so much of your staff. We are working incredibly hard to figure out how we do maintain that, the majority of our staffing, so that we're able to, you know, continue to roll on and also to keep people on board. We have an incredible team at Midland Center. So
Great, great. Brad Kaye, let me ask you, city manager at Midland. So how has staffing at the governmental offices, how at the city been, in both in terms of, have you had to make any cuts, and are people back in the offices? To what extent are they able to return right now?
Probably a multifaceted question. As I mentioned earlier, we have a lot of different services. We have everything from frontline personnel and police and fire, for instance, who have had to be on the job the entire time. We have done some adjustments in those areas, however, and made some changes. For instance, we had, when COVID-19 first came out, there was a concern that we had to have healthy officers. So the police department put in place what we called a pool, which was really a reserve of officers who were sitting aside, and their whole job was to stay healthy in the event that we did have an outbreak, when we did not know what COVID-19 was going to be like in our community and what the outbreak may or may not look like. So we made those adjustments early on. We also had to, because we could not allow for access to certain facilities, certain operations, certain parks programs, as an example, we had to close down many of our facilities. So our Civic Arena, as an example, has been closed down and continues to be largely closed down at this point in time. So we're running with the bare minimum of staff simply to maintain the facility, not to run any programs there at this point. The pool I mentioned a little bit earlier, we had to make the choice to shut it down for the summer as well, which meant we didn't hire the lifeguards and the other summer employees that we typically do bring on each year. And so those jobs for college students largely, or high school students in some cases, were lost and will not be back at least this particular year. We look at our library. Our library, unfortunately, flooded for the second time since in 2017 it flooded. And we did again this year. Our whole lower level was lost. Luckily, we were able to bring all of our material from the lower level to the upper level and save it, so that there wasn't a need to we actually didn't lose material. But it also meant we're very congested on the main level, and so the public don't have access into the building and can't be provided access right now. Our staff have responded by shifting to a curbside service. The unfortunate part of that, though, is that we don't need the same levels of staff to provide that service because people aren't physically in the building. And so we do have some people that are either on furlough or on work share programs at the library, and will continue to be until the lower level can be restored. The rest of staff have been, a lot of them at least, have been either through a work share or a furlough program. Some of them simply worked reduced hours, and that we've been able to slowly roll back as the executive orders loosened a little bit, and the in-person services that we provide, whether it be at our public works facilities, whether it be here at City Hall. The golf course, of course, was allowed to reopen and reestablish, albeit heavily damaged and still operating on a reduced capacity. So it's been varied. We have, again, with the exception of the library, which is our challenging one, the majority of our employees, thankfully, are back and working at least close to full-time hours.
We have a question, Brad, from Dave asking, what is the city doing to address $34 million in losses, and with only about 8% covered by insurance? How is the city going to maintain services with the challenge? So I guess looking a little bit farther out.
Yeah, so the 34 million in losses is a public damage estimate that was put in place, and that was what was submitted to the state of Michigan and ultimately to the federal government, and is part of the disaster declaration. The city itself, that's not all city funds. Some of those are county, some of those are road commission, some of those are MDOT. There's a number of different figures that play into all of that. The city's out-of-pocket costs that we're looking at right at the moment are much less than that, probably in the range of about $6 million. That, however, still, it's about 6% of our annual budget, so it's still a big hit on when we look at what we spend. And it's spread across a number of different operations. The library I've mentioned, Riverside Place, which is a senior facility right in downtown Midland that's operated by the city of Midland, had substantial damage the first time it's been flooded. The golf course we've mentioned as well, and then all of the other ancillary costs that came about. And so what we're looking to do, and we have been doing, as I mentioned, is we've used furloughs, we've used work share programs, we've cut back certainly on some of the services that we provide that will save on labor costs. Some of that we're hoping to get, quite frankly, through insurance proceeds. But with our government and our system, we're only entitled to and able to purchase up to $1 million worth of insurance, and that's our limits. And so we will use those funds as we're best able to. And then the final straw, right at the moment at least, is the FEMA disaster declaration and the assistance that's being asked for through that disaster declaration that the president issued. And our hope is that we'll get some of that funds back through that. We don't know exactly what the number is. The best case scenario, from what we've been led to believe and been told, is that that would be about 75 cents on the dollar, and it could be less than that. It depends entirely on what ultimately is awarded and deemed to be an eligible cost. Others are simply foregone costs. As we mentioned, we had about $1 million probably in direct employment costs that we incurred. So the refuse collectors that you saw out there working 12 and 14 and 16-hour days to pick up the refuse on the streets, that's just labor costs that we had to incur. We adjusted in last year's budget. We forego about $1 million in landfill fees to allow flood victims to transport materials to our landfill operations without having to pay and kind of get kicked while they were down again. So that again is a foregone cost. So we will hurt if the FEMA declaration and the funds don't come through from that. And if that were to be the case, quite frankly, what City Council will have to do and what we will be doing is reevaluating our budget come about the fall to see where we are, what funds may or may not be coming to us, and what the impact on our budget will be. It may mean we have to change our budgets.
Well, it's coming up quickly.
Well, we unfortunately, one of the difficult problems that we had was our fiscal year ends at the end of June. And so we hit all of these heavy expenses in May and June, of course, and had to balance our budget. And it took about $2 million in adjustments just to get through June. And now it's a matter of dealing with the rest of the costs as we move forward.
We're going to have a question coming up in just a minute about schools. But first, I want to do a little bit of a toss-up question because this could apply to any one of you. Give us a sense how the CARES Act is helping your organization.
I can start. In healthcare, again, from a national perspective, certainly there was a big focus on healthcare workers, and we have been the recipient of some CARES dollars. It certainly doesn't cover the entire financial outlay that has happened over COVID, but it has been significant for Mid-Michigan Health and greatly appreciated. And the only downside to some of the CARES dollars for healthcare is that more dollars are going to those hotspots. And in particular, if you have over 150 cases in your hospital, then you were eligible for more dollars. And as I said, we're blessed because our numbers here in Midland were only 44, but then also means that we aren't eligible for as many CARE dollars as that there's out there. But it has certainly been very much appreciated.
And who else has benefited from CARES funding?
Yeah, I would say a couple of things on the business side that we've seen is one, grant. So right now, last week was the finalized, they'd appropriated to the state, and then the state appropriated to local county organizations to help small businesses that have struggled with COVID. And so Midland, we've got just over $1 million. We're just got the applications in. We're going through those. You can get grants up to $20,000. And so we're going to be able to help a lot of businesses with that. On the broader end, certainly PPP helped a lot of businesses in terms of keeping people on staff. And so, and I said businesses, these grants also include nonprofits. And so, hopefully, as we've talked about, we don't know when this is going to end, but I think at least in the short term, for a lot of businesses, these have been really important resources to keep moving and to keep their staff on working and employed.
The center was a recipient of the PPP, and that is, we were able to keep staff on for the first 3 months completely, which was great. And so it's been incredibly beneficial.
I can just go Oh, sorry. Build on
Go
what
ahead, Holly. Yeah, I have a question for you next. So go ahead with the CARES Act and then I'll follow up.
Perfect. This has really been a lifeline to the nonprofit community, many of which who either saw a surge in demand for their services or lost the ability to actually run their programming that would generate revenue. So from the nonprofit community, this was a lifeline to allow them to continue to serve our community at a tough time.
So a follow-up question for you, Holly, from Pat, saying, my understanding is that United Way is taking over much of the ad hoc volunteer work that's been going on, especially outside the city itself. Can you talk a little bit about how the continuing needs will be addressed by United Way and its case managers?
Yes, love to talk about that. So I am part of a group called the Long-Term Disaster Recovery Group. United Way is helping with leadership of that, as many others are as well. And if you think about, I'll start first with volunteerism. As I said at the beginning of the show, this is going to be like a barn raising like no others. And it's going to take human power, it's going to take in-kind donated items, and it's going to take dollars. And there is no way we can put our community back together. If you look at just the $100 to $150 million worth of residential damage, we don't have that right now to put back into our community to get people whole. So volunteers are going to play a vital role, and they already have. I will say it's always been an interesting balance act. I love the passion and heart. Diane alluded to this. Our community is amazing. And even during COVID, and especially in the flood, we have seen volunteers step up in ways that have been unprecedented. Just in the flood alone, 15,000 hours worth of volunteer time were tracked. That's significant. And we always balance that with the safety of our volunteers, recognizing that for many, volunteering isn't an option. And because COVID is still in our community. So we always look at the safety protocols and social distancing and PPE and making sure that we are caring for our volunteers as our volunteers are out caring for our community, which is sizable. One of the ways that United Way is really helping to help with those both COVID and flood relief is kind of bringing our community together, and that means volunteers. We walked hand in hand with the city and county trying to recruit folks to do a lot of that damage assessment. Our nonprofits, I have to give a shout out to them. They are the unsung heroes in this story, that they stepped up and at a time when we needed them to. You know, United Way is a staff of 12, and it is bigger than the 12. It is the 1,200. And you saw our 26 partner agencies say, what do you need and how can I help? So for instance, early in the flood, we recognized that there were people, because of communication outages, and just fear and being overwhelmed, that we had 2,400 people who had reported damage. It was really important to us that we called every single one of those people just to see where they were at, how is their mental health, what are the immediate needs they had, what are the long-term needs, so that we could hand that off to our case managers ultimately and have them really hit the ground running. And our nonprofits really rose. They said, we'll loan you some nonprofit, we'll loan you case managers. And they helped. When we said we have 8 distribution centers that require, we're running them 7 days a week, they said, how can we help? Can we run them for you? And that's what they do every day. They work with this population. And we also recognized how important place was. That place matters, especially in a crisis. So we didn't want to have everyone coming to one location. We were bringing the resources to them, whether that was healthcare support, a listening ear, case management, basic needs, muck out kits, supplies, whatever that was. We wanted people to feel connected to where they feel safe. And we couldn't have done that without many of our partners on this call today, but also our nonprofit community. Moving forward, sorry.
Yes, by all means, moving forward.
So if you think about flood recovery especially, this is a very nuanced, collaborative, collective process. No one organization, no one person is going to be the solution. So we're just happy to be on the team. And it's going to take, as I alluded to, our case managers are also working, and I say our, as in the long-term disaster recovery group, not necessarily just United Ways, but working with a construction manager and a volunteer manager, bringing all 3 of those pieces together so that we can leverage everything we can to make as many people back in their homes and livable. We always try to level set expectations. We don't have the dollars or the people or the donations to bring everybody back to where they started, but our goal would be to get them safely back in their homes long term.
I want to look ahead. If there's one person amazingly missing from this panel, because we have such a wonderful panel, it would be someone from education as we're looking now at schools starting. So we're going to drop back and punt a little bit, but Diane, you're going to be our punter. So as the health professional on the board, what impacts are you anticipating as schools reopen in Midland? This question coming from Ellen, and it's a very relevant and timely question today.
Absolutely. And, even though we're in healthcare, certainly the education concerns and anxiety bleeds over into all of our businesses and all of our personal lives. So one of the things that we've heard from this community in particular is just a lot of uncertainty. So helping people navigate through the uncertainty. So if I could make a plug for people to not be afraid to ask for help, whether that's through mental health providers or social workers or case managers. This is not the time to be stoic and say you don't need help. This is the time to reach out and say, I'm having a lot of anxiety about what my children are going to experience. So even the fact that some are going to be virtual, some are going to be in person. Just recently, we had one of our pediatricians do a online kind of podcast to reassure parents about what it means to have your children go back to school and what would be important as parents to prepare for your children going back to school. So I think the more information we can get out there, there is a lot of misinformation around COVID-19, and I think just being as transparent and authentic as possible is going to help all of our school systems. And being patient, they're trying to navigate a world that they don't know either. And I think sometimes as humans, we want everybody to have the answers. And in this case, there are some cases where there isn't the answer yet.
Very good points. I want to bring our business community back in. Tony Stamas, so what would you say? It almost feels a little odd for me to ask right now with all the dual crises that Midland's been through, what if someone wants to open a business? What if someone wants to start a business in the community? So I guess my question is, have you been seeing that? And what advice do you have for someone who may be looking at that?
Yeah, I do think it's, when we had these, with the terrible flooding impact and obviously trying to navigate through COVID-19, but really the fundamentals in Midland are strong. When we look at, last year, we had the spin with Dow and Corteva and DuPont, and we have opened up the iPark. We've got Costco that's going to be opening up this fall. When you look at the downtown and, you kind of go around the community, you see a lot of exciting things and a lot of businesses. And I know, we've seen a few that were ready to go, and they're like, well, they're gonna wait a little longer until that they kind of see, but they're ready to go. And so we're talking to businesses. We've had businesses that have opened, and we're working with them to help promote their businesses. And so I think the fundamentals are really strong. I think we're going to keep moving forward. And I do think one of the impacts is going to be that, we talked before the call that it was hard to envision 8 months ago doing this call and having 100 people join us, knowing the technology. I mean, we knew we could do it, but we didn't really know, unless we had to do it, how to do it. And yet now it's become commonplace. And I think we're going to see entrepreneurs, just people are incredibly clever and creative. And I think we're already seeing it in Midland, and we'll continue to see that there's going to be some new opportunities in terms of how we do business as a community. And I think we're going to see people grow out of that. But I really feel like the fundamentals in our community are strong. When you look at, with Mid-Michigan Health and, all of our partners there, I think there's a great opportunity to grow. People are kind of trying to understand the landscape and how long it's going to last. But I think we're going to see continued growth, and I think some really exciting opportunities.
I have a question from Dave. And before I ask this, I want to remind our audience, we are taking your questions. You live in Midland in many cases. You certainly have an interest in this community, even if you don't live here at the moment. You're with us now for this event. So please, if you have a question, just click on the Q&A button on Zoom, type it in, and we will do our best to get to it with our panelists. So Dave is saying, he says, I have an entire neighborhood that's flooded, and now the basements are empty, but so are people's pocketbooks. And he says, trying to really connect people to organizations and opportunities for aid and for help. What is the best way to do that right now, to get that timely information about services and funding and assistance that might be out there? Brad, let's start with you. Give me the city perspective, and Holly, I think maybe you were ready to answer. We'll come to you just next.
Yeah, I'm largely going to actually punt on this one to Holly, because
Okay.
United Way has been the frontline agency by and large, and United Way together with the 211 network are the ones that are really the organizations that have been connecting people with the right resources and the right information, and putting people in need with the people who can meet those needs. So Holly, I'll bow to you on this one. I think this is your field more than mine.
Hey, way to set it up, Brad. Great. Yes, communication is so vitally important. And to Brad's question, it is really hard to know where the right information is. I'm going to give everybody out there a few numbers and sites to visit. First and foremost is 211. If you ever want to know about resources available in our community, we are so blessed to have a very robust 211 system. It's 24 hours, 7 days a week. Information referral system. So if it's happening in our community and in our region, they're going to be aware of it when it comes to human service needs. So that's the first call. The second thing, and I encourage everybody who has been impacted by the flood to, if they have not reported the damage to the self-assessment through the county, which is closed now, they can still get into the database by simply calling the case management team. That number is 374-8000. We have a team regionally of 5 in Midland County alone, 3 case managers that are going to be the ambassadors to anybody who has had damage, to walk them through the process, to help them connect with funding potentially, to walk them through FEMA, make sure that they understand some of the resources out there to help them, including some of those donated items as well. So the other website I'm going to point you to is reliefmidland.org. This was a website that we started at the beginning of the COVID outbreak, recognizing that 211 was such a vital link. So it's actually on the 211 page. But here we try to keep accurate, up-to-date resources and connections related to both COVID as well as to the flood.
Very good. Thank you. I want to bring Terry back into the conversation for a minute from the Midland Center for the Arts. Terry, you are keeping your organization kind of going greatly with volunteer help. You have historically have a deep tradition in that. And, you know, as we go through these difficult times, sometimes people are looking for that outlet. They want to be able to connect with their community. They want to be able to help. And yet there probably is certainly hesitation for what is the best fit and what is the best fit from a health perspective. Give us a sense for maybe some opportunities that you see. I suspect Holly may have some thoughts here too. But Terry, let's start with you, and maybe at the center, some opportunities that people could think about coming into perhaps help as a volunteer.
Sure. So, you know, it is interesting because we do, you know, we have about, 600 volunteers annually that work with us regularly. They are ushers, they work in the museum, they work with kids during camps, they are on stage in the choirs, in some of the performances. And, you know, sadly, much of that is not happening in the same way. So, you know, one of the things we've been figuring out as well is what are the opportunities for those folks to be involved. So we have been very excited to be able to have some of the outdoor events going on. We are utilizing our volunteer ushers in those events, and I know they have been very excited to be back, and we're excited to see them. You know, these are folks that you're used to seeing on a routine basis. Many of our people are with us, you know, and they work multiple shows and events a year. So it's great to be able to see them. You know, in terms of volunteer opportunities right now, we are a little bit limited, although we do have volunteer sign-up opportunities on our website. And as soon as we're able, we'll start, you know, more volunteer training and things. One of the things that we've tried to do is look at how we can use our building differently. So we hosted a couple of blood drives recently where we could get the entire community engaged and you know, come down and do that. And so we're going to continue to look at those kinds of opportunities where we might be able to use the building and people can participate with us in different ways. And while it's not necessarily a volunteer opportunity, we're also looking at what are the different ways for folks that don't feel so comfortable in person to participate online. We've now got a lot of classes, art classes online, lots of different content. And all of that is available on our website. So whether, you know, through volunteering or something that you just want to do as, you know, sitting at home and going, okay, I need more activities in my life, we're trying to keep those kinds of opportunities out there.
Wonderful. And, you know, as I was asking that question, it was popping up on the screen from Paula. So let's open it up to the wider community as to what, you know, even the governmental or health services or business community or Holly, again, I just have to believe you may have some thoughts on how volunteers can help right now.
Yeah, I'm happy to hop in, but everyone can join in. So volunteers play such an important role every day, right? Beyond our COVID struggles and now with the flood. But volunteers right now will play such an active role in the rebuild process. So if you think about, you know, the initial stages of the flood, it was all about the emergency needs, basic needs, and getting things out to people. Now we're into the long-term recovery, and that's about putting things back together. Volunteers are going to play a vital role. So whether that's group or individual needs, volunteers are going to be needed on every imaginable level. And really, we try to keep it very simple. For at least from United Way, we try to be the repository for volunteer opportunities and the connector, as well as the safety police to make sure our volunteers follow protocols and are safe. But if you go to our website, unitedwaymidland.org, or even reliefmidland.org, it's simply a click away and you can see a whole host of volunteer opportunities available to fit your criteria, your needs, your time of day, and things like that. But they really are going to have a starring role in the recovery of our community, and their heart is inspiring.
I would just add that at Mid-Michigan Health, volunteerism has been part of our history and part of our tradition. And even though COVID-19 is happening now and the flood where we're seeing more opportunities for volunteerism, I would say that there is always an opportunity at Mid-Michigan Health. There are so many opportunities for our volunteers, whether that's gift shop work or working in some of the reception areas, helping patients navigate their way through our health system. So if they feel a calling and they want something that might even last beyond just a crisis or a flood, Mid-Michigan Health has many volunteer opportunities.
Wonderful. This is a question I want each of you to answer briefly. What have you learned from the pandemic or the flood? And so kind of what lessons, if you will, or practices would you like to carry forward? There are silver linings to these unexpected, difficult events. What is your silver lining and what would you like to carry forward?
I'll jump in because I've given this a lot of thought, and we've talked as a leadership team about what has this meant. So the first thing I would say is all that preparation that sometimes you think is not necessary around emergency preparedness or these types of situations. I would say lesson learned. It's very important to continue to practice these scenarios as unlikely as you think they might be. So we are going to continue to do our preparedness around the things that you think will never happen. The second thing that we've learned here is that sometimes a crisis pushes forth initiatives that you've been trying to do, and there's been resistance to do them, and all of a sudden you have to do them in order to survive. So our example in healthcare is we struggled with trying to really execute on virtual visits. You know, for many of us, I'm a nurse by background, it's like that high touch. I don't want to do my care or my visit virtually. I want to see people, I want to touch them. And guess what we learned? You can be very effective virtually, and therefore going forward in the future, virtual visits are here to stay. And we do not see a future without virtual visits, and we've gotten very good at it. And you know what? People have really appreciated the virtual visits. So that's just one quick, example of where this crisis pushed us in a way that we probably would have taken years to get to where we are today.
Brad Kaye, as you look around the city of Midland as city manager, what do you see that you'll keep moving forward, that the community will keep?
I actually want to pick up on one point that Diane just made, and that's about the practice and the preparation and the disaster plans ahead. A large number of the community may not be aware of the fact that last August we actually did an exercise which was to prepare specifically for a dam failure. And that was something that at the time, as Diane mentioned, we all kind of go through it, go, yeah, you work through it. You grit your teeth, you get through the day and you go away. But what it showed was there were some weaknesses that we had in terms of our preparedness and our response plans, for instance, the evacuation plans. And by virtue of that exercise, it gave us the practice and it gave us the insight necessary to make sure that when this took place this particular summer, that we were prepared. And so that's why, in part, the evacuation went as smoothly as it did, as well as the cooperation certainly that we had from our residents. The other thing I take away from it, though, is that we did the dam preparation exercise, or dam failure preparation exercise, this last fall. In 2017, on the day of the flood, we actually had a 100-year flood or preparation exercise plan. So we are not planning any more exercises that deal with floods, because they seem to come true every time. And so that'll be one of my takeaways. The other thing, though, as far as our own staffing, our response to COVID in particular, we have been more aggressive and more willing to take some of the chances and try some things that perhaps we wouldn't have been before, or we might have been more reluctant to do so. And that could be things as simple as work schedules or work arrangements or work from home arrangements. Some of it certainly is the practices, how we go about scheduling people and working with people and dealing with even events like this where you're working remotely rather than everybody gets together in a room and sits down. And so I think there will be some benefits that come out of that for the city, cost-wise, benefit-wise, time-wise, and ultimately, hopefully it improves the services that we can provide by extending ourselves out in a way that isn't so tied to necessarily what we've always done, but looking forward to what we could do.
All right, very good. And Tony, I'm wondering what takeaways you think the business community has, and what takeaways you have working with the business community.
Yeah, I think one of the things Brad just touched on in terms of how we work anymore, in terms of working at home, working at the office, and what that balance looks like. I think that will be something that when we move past this, hopefully not too far down the road, that will be an ongoing part of our discussion. I've had business owners say, boy, I never thought, I could have people off site. And he said, it's working just as well, if not better in many instances. So I do think we've seen that, and I think that's going to kind of change the dialogue as each business looks at what's possible. I think for our team, it's been inspiring for the Midland Business Alliance team, for our ambassadors to watch how people have stepped up and helped. But I've seen that in businesses all across our community where they've stepped in and they've found ways to help their employees that were impacted, but then those that were surrounding them. And that's inspiring. That's something that I believed about the Midland community, but it continues to show that. But even, beyond that, when you kind of look at, I think you see a display in ingenuity. And, we've seen when COVID-19 came in, companies like Savant, Dow, Quadsil, Three Rivers, they started to pivot operations. They started to manufacture hand sanitizer and face shields. And so, it's something that you say something about a community, but what it really means is what we call our community, the city of modern explorers. And that's what Midland is. And I think we've seen a lot of examples in that as we've gone through 2020. And so you don't always know what the solutions are going to be or where that path's going to go. But I do know with the people that we have and with our community and being the city of modern explorers, it's going to put us on a bright future. And we're going to figure out some solutions that maybe we haven't even considered yet.
And we have less than 5 minutes left. Terry, I want to bring you back in real quickly from the Midland Center. So, we can look at different ways of doing business and going virtual, but I just keep thinking of your performers who need to be on stage, who need the audience, and that sense of community that the arts can build so very effectively. And yet, what are your takeaways? What changes do you see continuing going forward?
Well, that's a good setup to to kind of where my head is, which is that, nothing is a given. Those things that you think are so set in stone that will never change, can change. And so it's been very interesting and fascinating. I mean, the incredible both resilience, talent, creativity of the team at the center has absolutely amazed me. As we've taken this idea of everything that we fundamentally do and said, okay, what if we don't do that? What if our mission is to be a gathering space and we can't be a gathering space? How do we still connect people? And so I think, you know, both this idea that you really can challenge any fundamental assumption and that people are very resilient and creative are two things that I will take out of this. And in terms of where I see it going, you know, like Diane said, telehealth is here to stay. I think in some ways virtual is here to stay. I do not think, I really don't think people are, you know, that digital and watching at home, watching a play at home on our TVs is going to replace going to the theater. I think that will continue to be an experience, and there is something about that live energy. But, you know, figuring out what pieces of that do change, because I think there will be more content that can be delivered in some sort of virtual fashion. We've had huge success with some of our classes, even reaching international audiences and things. And that's, I think, very interesting.
And Terry, a follow-up, and we're running out of time, but I keep getting questions in, and I want to get the questions in while we can, so think of this as our lightning round. The question coming from Pat is, the main center still closed due to the pandemic or to the ongoing damage repair? Where are you on that?
I'd have to say yes to that, both of those. So we are not at full power. We still have power in the building, but it's generator power mostly. Because we are working through, as Brad mentioned, the FEMA process to figure out, because our power was damaged, we would love to try to move it out of the lowest point in the building so that we don't run into this situation again. So that's why it's taking longer to repair. But we can't be open you know, at this point, gatherings are not allowed, so we really can't open the building anyway. So we, in some ways, now have the luxury of the time to really look at what's the best solution to keep this from happening again.
Diane, with the healthcare system, Brian is wondering, do you think that, and this could be for any of you, but Diane, you're our health person, so I'm coming to you. Do you think the new sanitation standards that we've been experiencing with COVID are here to stay?
I do. I think, you know, if we could have had this kind of a response around sanitation with flu, I think our number of influenza cases across the nation would be significantly less. So I do believe that the new standard for people is going to be expecting that things are much more sanitized than we have in the past. So to the extreme, probably not that we're seeing, but do I think that airplanes and air travel is changed forever? Yes. Do I think that people are going to expect to see sanitation wipes when they come into a facility? Yes, I do. And I honestly, from a healthcare perspective, this is a good thing.
All right, we have a question from Andrea that I think is a really good question and timely, and I'd like to present it to you. So COVID and flooding have really, of course, challenged your community like few other things. At the same time, we're seeing challenges with social injustice and racism across the nation and in all of our communities. So they're wondering, since the protests, are any of your organizations making changes? What kind of changes are you looking at to add programs to perhaps support marginalized community members and make sure that they are supported and included and really recognized in the Midland area?
Maybe I'll start that one.
Great, because it was a toss-up. Thank you.
I knew somebody had to jump in. So as the community knows, we had, following the death of George Floyd, we had demonstrations that took place in our community centered around the social justice issues and the Black Lives Matter movement. And since that point in time, the city is participating in. It's not necessarily our group or our organization, but it is being largely led by a member of council, Diane Brown-Wilhelm, as well as members of the community and a number of city employees as well. And what we're looking at really there is, what should the community's response be to this initiative? We are very consciously taking the steps that we are not going to do a knee-jerk response to what the national discussion is or what to the national movement might be, whether that's the defund the police or the strict Black Lives Movement policies that they would like to see, but truly looking at it from a data perspective to see what challenges do we truly have here in the city itself. And once we determine what those challenges are, then we'll respond based upon our community needs. So we want this to be very much a localized, community-based response as opposed to something that is done just to be done. And so we have dealt with, and I should say not dealt with, we have talked with Anti-Racist Midland as a group that has gone to the school system. We've had them in and discussed with them what they would like to see, and we'll continue those forward. It started with us putting out a message that we hear you. That was the title of the message to our community. We are looking probably in the next few days, putting out a subsequent one to say, look, we promised that we would have discussions. We have been, and we will continue to do so. So we will reinforce that in a couple of months or a couple of days.
The only thing I would add to that, the only thing
Go ahead, Diane.
Yeah, thanks, Terry. The only thing I would add to that is, Amy, we could probably do another whole session just on this. And I think because it's been so important for all of us. So what Brad said is a ditto in our organization. We've always had policies on diversity, inclusion, but we are taking a look to say, what is it that we need to do more of? And we will continue to do that in the future. But I'm serious, we could talk, all of us could talk for another hour on this topic.
Absolutely. And Terry, final words.
Yeah, I was just going to follow up as well on Brad's comments, which is that, you know, the center's mission as a nonprofit organization is to be a gathering place for everybody. And so that everybody means everybody. And so we have been working very diligently to have more artists of color represented on our stage, to bring cultures in that not everybody may get a chance to see. We work very closely with the schools, and this is a really important question. I said in the opening remarks, it's been challenging to have this, you know, going on at a time when you can't have as many face-to-face conversations. But we will be carrying this forward. We have a new series that we're launching called Artisan Authors, and we'll be bringing in, I think, some really prominent voices on these topics for the community and moving forward. And, you know, it's an important discussion, and it's an important discussion for all of us as we work to make Midland the best community that it can be, because it's, you know, such a great place to live.
All right, I want to thank all of our panelists for joining us tonight, and I really want to thank our audience. The questions were great. I'm sorry there were a few we didn't get to, and if we can find a way to put them to our panelists afterwards and make them available to you, we will absolutely do that. So thanks to our panelists, Terry Trotter with the Midland Center for the Arts, Brad Kaye, Midland City Manager, Holly Miller with United Way Midland County. I'm always tempted to reverse that, United Way Midland County, and Diane Postler-Slattery with Mid-Michigan Health, Tony Stamas with the Midland Business Alliance. Thank you so much. You guys were great fielding all of our questions. And for everyone who's involved right now, you will be receiving an email. Let us know what you think of this. Let us know if you'd like to see more conversations like this. And again, thank you for your involvement. I'm Amy Robinson with WCMU, and I wish you all a good night.